Nositembele Qobozani visits tuberculosis patients in Imizamoyetu Township in the Western Cape.
Oh, how are you, my darling?
Nositembele has been treating this patient for 3 months and says she's seen an improvement. But she's worried about contracting the highly infectious disease herself.
Our government or our company must give us something like a medication that we can protect ourselves to get a disease from the patient. Because the patient we are dealing with them, they are having a TB exactly. They are coughing and you can't stop them to cough when we are there. So it's not easy for us.
Nosimo Makoko stopped caring for TB patients when she contracted the disease 2 years ago. She says she's still not fully recovered and can't return to work. TB experts in South Africa say healthcare workers are 3 times more likely to contract TB. And this is worse in overcrowded and under-resourced public hospitals where infection control is inconsistent. Tuberculosis has been the leading cause of death in South Africa for the past decade. According to the Department of Health, 60 people die from TB every day. Even though countries like South Africa have introduced new technology and medication to fight the disease, experts say at this rate it would still take another century to fully eradicate tuberculosis. Health organization TB HIV Care says each year up to 160,000 people in South Africa are diagnosed with TB but don't return for treatment, which potentially increases their chances of developing drug-resistant TB.
The issue is that a lot of people aren't able, due to the realities they face every day, to actually complete the medication. They're not getting the necessary support. Accessing treatment is labor-intensive. It requires out-of-pocket expenditure, which a lot of people are not privy to support themselves in that manner.
More than 450 TB patients can be treated for the cost of treating just one drug-resistant TB patient. The World Health Organization estimates that a quarter of the world's population has TB. It says far more needs to be done, and the $13 billion global budget to fight the disease is simply not enough. Fahmida, Jazeera, Cape Town, South Africa.